welcome home. This is where we always meet. I'm glad to see Phyllis. I'm glad to see Makwasi. I'm glad to see Haz. I'm glad to see John. I'm glad to see Douglas. And it is such an honor to have you. It is such an honor to always have you log in faithfully. It is not, I don't take it for granted. Fridays are usually busy days, and in the evening people want to go out, but you choose to come and have a session with Carol, your health coach. Today we are talking about the prostate gland, and I'm happy that we have more men than we have women, because these men will be able to learn something about the prostate gland. And as we know that our sessions are inspired by you, our sessions are requested by you, our sessions are requested, not requested, you are the guys who prompt us. So feel free to let us know what topic you would want us to talk about, and we will definitely explore it. So as a naturopathic health coach, we look at the most natural ways of doing life, living a healthy lifestyle. So we are here as a team of healthy living ambassadors. If you're logged in, Kenneth, welcome. If you're logged in, it means you are a committed healthy living ambassador who is ready and willing to always learn more about the naturopathic ways of life, to live a healthy lifestyle, and to be able to inspire other people to live a healthy lifestyle. So whatever we talk about here, we try as much as possible to be as natural as we can. So today we are talking about this wonderful organ that God gave our men. Now today I am on the other side. I am talking not from personal experience, but from what I have learned. And I am glad, I am sure we can talk about it, because sometimes you don't have to have experience to learn these things. So the prostate gland, and there was a trigger that I posted on Facebook. And it caused so many questions, it caused so many comments. Some people really misinterpreted it, and they did not understand what it meant. And before the end of this session, we are going to briefly talk about that post and what it means, and why I had triggered our thoughts with that post on Facebook. So the prostate gland is a wall size. It's a nut. It's a very small. It seems very small in the physical eye, but the kind of work that it does is very powerful. But the prostate gland is one of the organs in the male reproductive system, where it manufactures. I will say, yes, I must say manufactures, because we say here on our notebook, we use the simplest language possible. So it helps manufacture the fluid that helps the sperms to be able to flow smoothly. And this fluid is the one that we call the semen. So the prostate gland is where the manufacturing of semen happens, and the semen is the one that helps push the sperms to for fertilization during ejaculation. So this prostate gland is usually situated between your penis and the bladder. It is situated between the penis and the bladder. The prostate gland, something that I want us to note as we continue, is that the urethra is where the urine comes out of your system from, and it is also the same path that the sperms are ejaculated, that they come out of your body. It is placed strategically placed by God in a place where it is able to facilitate both. So when the prostate gland produces the semen, and during the sexual intercourse, or during in preparation of an ejaculation, the semen is pushed out to the urethra, where it meets the sperms, and the sperms, they are able to swim and flow out. And that is why most of the time when a man has a problem that is related to the prostate gland, the urine system is really affected. How God has created men is that during puberty, the prostate gland actually doubles in size, like it grows, you know, during puberty when this young man is being formed. And then at some point, it stops a bit, it stops growing. Then by the time they're getting to 25 years of age, it again starts growing. Pole pole, pole pole is slowly, for those who do not understand Swahili. It starts growing, and it's a natural process. It's a natural process that the prostate gland keeps growing. But then as this man ages, because this is, I mean, it's triggered by the hormones, and the hormone that we know very well that is related to men and their functioning is testosterone. And so as the man progresses, as the man grows old, the prostate gland keeps growing, but in a very regulated measure. Now, the challenge comes in if at some point, and especially most of the time, it is after the age of 50, when this prostate gland starts swelling, and it swells beyond. It swells beyond how it is the size that is supposed to be. And that is when now this man starts experiencing changes in the urinary system, where they are not able to pass urine, whether either it's painful to pass urine, or you feel like you want to pass urine, but when you go and empty your bladder, you still feel like the bladder is still not so empty. Or when you're trying to pass that urine, the force is very minimal, and you feel like you really have to pressure that urine to come out. That is one of the first symptoms of an enlarged prostate gland. And an enlarged prostate gland does not mean that you have prostate cancer. I want us to get this point, that an enlarged prostate gland does not mean you have prostate cancer, because an enlarged prostate gland is benign. It is not cancerous. You know, when we say a growth is cancerous, it is when we say it is they call it what? There's this word that has just disappeared, the opposite, or malignant. Yes, that is the word I'm looking for. Yes, when we say that someone has cancer, a tumor that is cancerous, we call it malignant. But an enlarged prostate gland, which is something, it is a condition that has affected different men at different times of their age, and sometimes the prostate gland can actually reduce in size by itself. So some men will have an enlarged prostate gland, and they will not even be able to notice, because it will somehow magically heal itself. But then there's another category where the enlarged prostate gland, there's nothing much that can be done, because it has already enlarged and it is already blocking the urethra, and it means then that it is swollen beyond how it should be swollen. It is at that point that a man should go to hospital, so that the doctor can be able to check and be able to advise. Sometimes it has overgrown to a point where it needs surgery. Some other cases, it is just medication. It depends on different personalities. So you will ask me, what really causes an enlarged prostate gland? And I will faithfully tell you that for now, no one is able to really point out and say it is this, or it is this one. Mostly the medical field has classified the cause of an enlarged prostate gland as a hormonal imbalance, a hormonal issue. And the thing about hormonal imbalance, the hormonal issues that we experience, sometimes we don't have a way to regulate them. But sometimes we can be able to regulate our hormones through the kind of lifestyle that we are living. So I will talk about the lifestyle, and when we are talking about the treatment of the different prostate gland issues that we have. So we are talking about the swollen, the enlarged prostate gland. Most men who are affected by the enlarged prostate gland are 50 and above. And this, I've explained, it's because sometimes every now and then the prostate gland keeps growing. I think I want to stop there with the enlarged prostate gland as I tackle another condition called prostatitis. If you attended our women reproductive health session, We talked about candidiasis, we talked about vaginitis, we talked about that, and it is an infection. So prostatitis is also an infection that affects men. When you have prostatitis, you have an infection, an inflammation on your prostate gland. When there is an inflammation, it means then that the production of the semen, it means then that the normal functioning of the prostate gland is not the same. So this prostatitis is just a normal infection, just like we talked about in the women reproductive issues. We were talking about infections, and this infection can be caused. It can be caused by a bacterial infection. It is not, unless it's very severe. Sometimes it heals itself if you change your lifestyle, if you're able to contain it just the way you contain the bacterial infections. Sometimes when you cannot be able to contain it, you go to hospital, you consult a urologist, and they are able to administer antibiotics. If you are able to do, if you are able to catch the symptoms early, now the challenge comes in because the symptoms are really intertwined with the enlarged prostate gland and all these other issues. So the only biggest, challenge that we see in men when they have prostatitis is the urinary function is interfered with, just like with the enlarged prostate gland. At the same time, when the bacterial infection is beyond, the man might experience something like back pains. Like by that time, the bacterial infection has really grown. And that is when a man is told, you need to now consult a doctor. Sometimes the inflammation is too bad that the urine turns red. It has blood. But it is in very rare cases when you really, really have waited for it to grow. So we have talked about the condition of prostatitis. We've said that the cause of the prostatitis is a bacterial infection. It is an inflammation that makes the prostate gland inflamed, and the enlarged prostate gland is a natural process that sometimes goes beyond the nature. Now, the other condition, there are three conditions that affect the men's prostate gland. The last one that most people talk about very frequently is the prostate cancer. Prostate cancer is when now there is and not, of course, when we talk about a tumor is of a production of cells, when the cells are over multiplied. And so when they are over multiplied and there is a tumor, and then that tumor is malignant, that is when now they say you have prostate cancer. When you're told you have prostate cancer, it means then that the prostate gland is in most cases swollen as a result of that tumor that is malignant. We have said, for all those people who are logging in, welcome. I see your many people still logging in as we continue. We are on the third condition that affects our prostate gland. We have explained briefly where the prostate gland is located. We have explained the function of the prostate gland, and we have said sometimes it seems very small to the naked eye, but the kind of work that it does is quite strong. So now we are looking at the third condition. The first condition we looked at is the enlarged prostate gland. The second condition is the prostatitis, which is an infection that affects the prostate gland and causes inflammation. Now we are looking at the third condition that affects the prostate gland of a man, and it is prostate cancer. We have said that the difference between enlarged prostate gland and prostate cancer is that the enlarged prostate gland is a swelling that does not, we say, now that is when we are saying it's cancerous. See, the tumor Hello, I am really sorry. I don't know what has happened to my signal. Are we back? Someone signal me or tell me on the chat box if I am back or if you can hear me.
Yes, we are on.
Okay, fine. Thank you very much. So we continue with the session. Kindly mute yourself. Thank you very much. I'm really sorry about my signal. So we were talking about prostate cancer, and just like the other symptoms, the other two conditions that we have talked about, prostate cancer also has the symptom. The first symptom of prostate cancer is when you are trying to pass urine and it feels like you really have to pressure yourself to pass that urine, like the pressure is really low. Or when you feel so pressed, you run to the washroom, and when you get there, the urine is not coming out. There is also another situation where the urine comes out on its own without any control. That is usually the first symptom of prostate cancer. When you have these symptoms and you go to hospital, they are able to check and differentiate between the three conditions, because unfortunately, the three conditions share the same symptoms. The second symptom of prostate cancer that now, as it keeps progressing, is when now the urine color changes. It starts from being the normal color of the urine. I hope my brothers, your urine is not yellow, is not orange or yellow in color. Your urine should be clear. To tell me that you drink water, your urine should be clear. So the second symptom of prostate cancer is when your urine starts changing from the normal color of the urine to either cloudy, it starts becoming cloudy, or in worst cases now it becomes bloody, that your urine is blood. So at that moment, it means that the inflammation has really happened and the tumor has really been, it means it has really interfered with the system. Now, the third symptom, which comes in as the tumor keeps growing, is when now you start having back pains, joint pains, something related with your joints, and the body function is really interfered with. And you can tell as a man, you're not able to feel healthy as you were feeling before. Of course, by this time, your sexual activity is really affected, because remember, the prostate gland and the urethra they are very interrelated. When we started, we said that the semen is produced at the prostate gland. And if you don't have enough semen, the sperms will not be able to come out well. And we also said that the urethra is right at the center of the prostate gland. So when the prostate gland is swollen or it is inflamed, like it will be at during the condition that we talked about first, then it means that the ejaculation process will also be interfered with. So it means that the three conditions will also interfere with your sexual activity. So by the time prostate cancer now it's getting to show these symptoms that I'm telling you about, you have already had very low sex drive, you're not able to really function well sexually. The other symptom of prostate cancer is when now you start shedding off weight in a way you cannot explain. You know, your weight just keeps disappearing and you cannot explain about that weight. Sometimes it is very confusing for most people when it starts disappearing and they think maybe it's their diet or something. But if you have all these symptoms and you know that you could be going through, because I know for us, my brothers, I love you so much, all of you, but because of the nature of how you are created, by the time a man is admitting he needs help, he has really kept that problem into himself. But please, my dear brothers, when especially the passing of the urine is being interfered with, seek help. Talk to Carol, your health coach, and she will advise you. The three conditions that we have talked about, the prostate gland, swelling, the prostatitis, and enlarged prostate gland, are not sexually transmitted diseases or sexually transmitted infections. Okay? They are not sexually transmitted diseases or sexually transmitted infections. So when we look at the prostate cancer, when you see these symptoms now, when you go to hospital, they are able to do a scan. Previously, men were telling me that they don't want to go for screening for prostate cancer because the prostate gland previously, before now technology came, where the prostate gland is located, it is in between your anus. Like the doctor could only feel it through your anus. So they insert some fingers and they find it and they squeeze it to feel if it is swollen. So previously, that is how they were checking for prostate cancer. But today they have a blood test. Then you just need a blood test. They will take it. They'll take it to the lab and you will know. So please, if you are one of those people who are scared to previously check for prostate cancer, please go to hospital and check. You just never know. The other question that I am asked very often is that, does it mean that prostate cancer only affects the old men? No. Prostate cancer can affect anyone who has a prostate gland, let's say that. It is very rare. It is very minimal, very, very minimal for men below 40. But we have had cases of 1, 2, 3 cases of men above below 40. It is very rare for men below 40, but we have had cases of men below 40 having prostate cancer. So when you go to hospital with prostate cancer, there are a few different treatments. They can do surgery, they can do chemotherapy, they can do radiotherapy, depending on the stages. Because again, the stages of the prostate cancer determine the kind of treatment that your doctor will prescribe. There are some stages, the early stages, that there's something that can be done very fast and it can be resolved. We also have people who we have seen in the 4th stages where it has metamized. I don't know how to pronounce that word, but it means like it has moved to another organ. But the exact pronunciation, sometimes because of the it really beats me. So when it has that one, then the doctor is able to explain to you what treatment that they will be able to do. People ask me, if I have prostate cancer, does it mean then that I will die? Not necessarily. We have people who have survived prostate cancer. Then there's another question, a very interesting one. If I have prostate cancer, or if I have surgery because of an enlarged prostate gland, will I be able to function sexually? That is a question that I have been asked enough times. It takes time. It takes time for a man to recover the sexual activity, but with patience, with a lifestyle change, with the proper care, yes, a man can go back to functioning sexually, properly functioning sexually after surgery, but it takes time. Before then, there's another question that I'm answering the questions that have come up as a result of the post that I did on Facebook. The other question I was asked is prostate cancer caused by lack of sexual intercourse, lack of ejaculation, or is it caused by excess ejaculation? This question has really brought up a very serious conversation, and I'm foreseeing us having this specific discussion next week when I'm looking at my timer, and I know my timer, Mr. Douglas, is just about to tell me that I have 8 minutes to go. I will say it is a discussion that I would want us to have in any wholesome. So does your sexual activity interfere with the possibility of you ever having prostate cancer? No, it doesn't. But yes, it does. There are people who argue that if you don't have enough sex, you will have prostate cancer because the prostate gland will not be producing enough semen, will be producing semen, and you're not ejaculating. Yet naturally, a man should be able. So Douglas, you're on fire. You are being told to increase the time by at least 10 more minutes, Bwana. Unfortunately, it's not Douglas who times. It is how we have set it up so that we do not bore you with all this information, and also because we want you to take quality information and not even the quantity. We don't want you to take the quantity. So Douglas, you are on fire. You're being asked to add more time, but unfortunately, it's not Douglas who does that. So the argument for those people who argue that if you don't have enough sex, you will develop prostate cancer, they argue that the semen is being produced, but it is not being removed. It is not being ejaculated. So they argue that it might cause the tumor to grow. But no, the tumor was not, remember, the prostate cancer tumor it does not grow because of the amount of semen in your prostate gland. That is not the reason. Remember, your prostate gland does not enlarge because of the amount of the semen that you have in your body. No, there is no relationship between those two. Someone else is saying compensate the time we lost. Douglas, you're in trouble. Please be added more time. That question is very pertinent. Yes, I really want to answer it, but it is so diverse. I want to show you all the angles, and I am sure we'll not be able to answer that question in the 5 minutes. So that is why I'm requesting we are going to log in and say we will do the sex activity. Does it give you any sexual health? To answer, now that today we were looking at the prostate gland, I will be able to give you a hint or 2, 3 things, action points of how you can be taking good care of your prostate gland as a man. Number 1, for you to be able to take good care of your prostate gland, remember there's a lot of hormonal functions happening in your body. You need to be careful of what you are eating, your diet. If your diet is very compromised with very refined carbohydrates, very refined sugars, all these foods that cause hormonal imbalance. I know most men think that it is only women who have hormonal imbalance. No. Men also have a hormonal imbalance. And so if you keep interfering with your hormones balance, then it means then that your hormones function will be interfered with, and it will interfere with your prostate gland. So the first thing you do to take care of your prostate gland, which is one of the major organs of your reproductive health, is watch your diet. In your diet, have more vegetables, more fruits, less refined carbohydrates, less refined sugars. Tobacco is known to interfere with the process, with the liver function, which interferes with the hormonal production. The next thing that you can do, point number 2, is the lifestyle change. The other lifestyle change you can do is the stress levels. Minimize on the stress levels, because whenever your stress is high, again, I go back to our stress hormone called cortisol. When the cortisol level is high, it interferes with the production of testosterone, which interferes with the function of the prostate gland. So for you to take care of your health of your prostate gland, please be careful and keep off stress, or try and minimize and manage the stress. Because again, if you're stressed, even your sexual function, you'll not be able to function sexually. Number 3, the thing that you can do to help your prostate gland is to drink a lot of normal water. When you drink enough water, you're able to provide your body with the right fluid, the right pH, because semen is a fluid. And this fluid, the higher percentage is water. So if you keep drinking enough water, then it means then that you will be able to produce quality semen, quality sperms, and you will be able to have quality ejaculation. So next week, I would want us to talk about 2 things. 1 thing, the sex function. 2, what is quality ejaculation? What about that man whose sperms just come out? You know, there are people who, after taking maybe Mira, the sperm just comes out involuntary. We are going to talk about that. Oh my goodness, we have so many questions on our chat box. If one has consistent back pains but passing urine without any challenges, should he start thinking in that direction? I would say yes, and there's a possibility that every time you go to hospital, they check only the back, they never check the reproductive system. As when the next time you have an appointment with your doctor, as much as you're doing the scan for your back, also see a urologist to just assess your reproductive system, because maybe there could be another underlying factor that is causing that back pain. I only have 3 minutes, and as always, we will do our action points. We have said we will take care of our prostate gland. 1, we will watch our diet. 2, we will minimize stress. 3, we will drink water. 4, we will exercise and exercise properly, do proper exercises. And then next week at 8 p.m. on Friday, we are going to log in and ask, what is quality ejaculation? What is the good amount of sex? And the amount of sex that you have, does it only interfere with your prostate gland or with even your other sexual reproductive health organs? As always, our time is flying as always, and I am always happy to see you today. All our gentlemen, congratulations. I see Team Uganda, Team Kenya, Team Zambia. Oh my goodness, today we even have Team Tanzania. Thank you. Today, our house is well represented. Thank you for logging in. My name is Carol Nyamburanganga, your health coach. You can always reach me on 0711 621563. Let me repeat that. +254 711 621563. Be sure to go to our YouTube channel, Rejuvenating Nature's Beam. Like, subscribe, and share with your friends. You can also send us an email. And always, we are looking forward to meet you here every Friday at 8 p.m. East African time.